Well, when it comes to looking younger, this year the stars are looking, or loving, quick fix things rather, solutions that require little to no downtime.
Dr. Will Mooney is back and he's here with the latest trends that work. So look, it's just announced that Botox can now be used to help us lose weight.
Indeed it does. It's the multiple uses of Botox never cease to amaze me. It actually works. This has got legs, this story. However, it's not for celebs or you trying to lose the last bit of Christmas pud. It was first used on rats at the Catholic University in Rome. That's fat, holy rats. Oh, wow. And it was injected, and what it does is decrease transit time through your gut. And so it means you stay fuller, longer. And then Trondheim University up in Norway, it was used as well with great effect. So it does work. You endoscope down inside the lining of your gut.
Okay.
It's used as a replacement. This is not a lunchtime sort of fix.
No.
It's a replacement for morbidly obese patients instead of gastric banding.
Righto.
Because that surgery is high risk because they're obese patients.
Yeah.
So yes, it works. It's not really in the regime of A-listers and cosmetic.
You don't want to shove a needle down your
throat. It might not be for average Joe just yet.
No, that's it. For trying to lose that little love handle, no.
Steroids and peptides, they're buzzwords at the moment.
Absolutely.
Human growth hormone as well. They've become widely spoken about recently. Some of the A-listers are getting behind them.
Well, look, you know, they're widely used. In the 1990s, the most frequently injected illegal drug in Sydney was heroin. In the noughties, it was amphetamines. Now it's steroids. If you spent time on the beach over summer in Manly and Bondi and saw those bunch of super busted-out, muscly young guys...
I don't go because of
who's intimidating, David.
Yeah.
Bodies like a plastic bag full of walnuts. They're on the juice, OK? They're the guys who are having steroids, and it's widespread. It's endemic, in fact. And it's endemic because it works. In a short amount of time, you bust out, you get great muscle mass, you cut fat, but the side effect profile is unacceptable.
Well, so long-term, the side effects?
Well, even short-term bursts, their side effects are bad. You get atherosclerosis, cardiac problems, and, David, testicular atrophy, and nobody wants that. And
is that where they go like pigs?
I don't know what that is, but it doesn't sound good.
Testicular atrophy doesn't sound good.
It doesn't sound good at all.
Lot of good.
Although I have taken it as my punk band name.
Yeah, testicular atrophy.
We are testicular atrophy.
For the balance or for the punk balance? So when you see these celebrities who busted out, some of them have admitted to using it. This is steroids. Only steroids can get a body like this. To go from there to there, in that amount of time, I suspect steroid use. When actors bust out from between their rom-com and their action adventure, suddenly they get an 8-pack, I suspect steroid use, because it works and it's a short-term fix, and that's the attraction of these sort of drugs.
You can spot it
the next drug is human growth hormone, and I reckon this has got legs as a drug for the future. Other hormones that drop, we replace. When your insulin is low, diabetics, we replace it. When your thyroid's low, we replace it. What happens with human growth hormone is it's high in your 20s, it drops during your 30s and 40s, and replacing it to within normal range theoretically improves muscle mass, leanness, your mood, your libido. I think it could be a drug for the future. At the moment, it's still questionable. Now, a lot of celebrities that have admitted using it, Sylvester Stallone was caught with it at Sydney Airport, and he said when he was caught in Australia, this is the drug that everybody will be on in the future. And when you look at these celebs like Madge...
That's not really an excuse, though, at customs. I've got to tell you.
Yeah, everyone's on it. It's not my problem. Doesn't everybody use it?
Yeah.
Did you try that line once?
No, never. Madonna, you think she's doing it?
Look, Madge, you know, she's so cut. She's got to be doing something. I mean...
Courtney's done everything, so I'm not surprised that Courtney Love's tried this one out.
She's using the smorgasbord of drugs technique, really, so it's hard to know what the active ingredient is.
Let's get on to fillers, because they've been Hollywood's secret weapon for years, but you say there's a new kid on the block to fillers.
Sculptra is polylactic acid. Sculptra. And it is for deep plane filling, and it's great. It's got great effect. It got some bad press 10 years ago. I think the concentrations used were wrong. I think now we've got it right. It's used as the foundation, and over the top we use other microfillers as well.
So that Demi is using Sculptra?
I think when you see these amazing cheekbones that just stay and stay and stay, that this is the sort of face you achieve with Sculptra. Whether or not she's used it, I couldn't comment, but I suspect it.
She's not watching.
She calls me up all the time. It's annoying.
I know.
There you go, Sculptra, fantastic. So these are the areas, the deep plane, where you get losses in these deep planes. You set that up, and it just gives you a lovely natural look. And over the top of that, you use your other techniques.
All right, buddy, thank you so much. Up next, South America, we explore Santiago.
Santiago.
And all it has to offer right after the break.